Uh, this is the second lecture of the joints series. Before this lecture, I did an overview of joints. So just remember, joints are also called articulations or arthroses, and they can be bone to bone, bone to cartilage, or bone to teeth. So this video, we're going to talk about diarthroses. So the functional class we'll talk about is diarthroses, and structurally these joints are synovial joints, and then these are the subcategories of the synovial diarthrotic joints. So we went over this on the last lecture, but there's two major classifications of joints. There's functional classification, that's the amount of movement that's permitted by a joint, and then subcategories of functional joints are synarthroses, amphiarthroses, and diarthroses. And for this lecture, we're going to be talking about the functional category diarthroses. You can also classify joints as in structurally, so that's how the bones are attached in a joint. And the subcategories of structural joints are fibrous, cartilaginous, synovial, and synostoses. And this lecture, we're going to talk about synovial joints. So here's a cartoon. If you look here, you can see let me click me out of the screen. So if you look here, you've got this black box around your finger, a joint in your finger, and then they enlarge it, and it shows this is the proximal phalanx, this is a middle phalanx, and then the distal phalanx would be this little bone right here. But you can see that the joint, the synovial joint, that's a structural classification. Functionally, this is a diarthrotic joint. But the synovial joint has this joint capsule, so on the outside you've got a ligament. Remember, ligaments go bone to bone, so ligament takes bone to bone. And then, so the joint capsule includes the fibrous part of the capsule, which has the ligament as an attachment, and then deep to the fibrous capsule of the joint capsule you have the synovial membrane. So that's this pink stuff here. This is all synovial membrane. And notice it says down here synovial membrane doesn't cover the hyaline cartilage. So the hyaline cartilage is in blue. So here's the hyaline cartilage on the middle phalanx. Here's the hyaline cartilage on the proximal phalanx. And I just want to make sure. I don't know why I'm not getting a laser pointer on this, but anyway, hopefully you can see that I'm moving the cursor, or you can see where I'm moving the cursor. So the articular cartilages, they're made of hyaline cartilage, and they are on the ends of the bone. And the synovial membrane just goes from here, so if you follow the pink line, this is all synovial membrane, and you come down here, it ends, the synovial membrane ends right here, and then the blue stuff, or the articular cartilage, starts here, and you can see the synovial membrane doesn't cover that. Then the joint cavity is all this brown stuff, and it contains the synovial fluid. So the articular cartilage, we talked about that. It's called articular cartilage because it's cartilage between two articulating bones. But the type of cartilage it is hyaline, and it's there to provide a smooth surface in the joint. Here's some more details about synovial joints that you can read through. This is synovial joint in rheumatoid arthritis. So here's the normal joint on the left. Here's the joint capsule. You can see the synovial membrane is here, and the synovial fluid is in the synovial cavity. In rheumatoid arthritis, this synovial membrane gets thick and inflamed, and it secretes extra synovial fluid that's characteristic of rheumatoid arthritis. This is a cartoon showing the immune cells that live in a joint capsule. So if you come over here, you see this little square, and then they enlarge the square, and it shows this thing called an interstitial macrophage. Or macrophage. It's a type of phagocyte. Phagocytes like to eat things. So these phagocytes that live in your joint will eat not only bacteria, but they'll eat any debris that they find in the joint capsule. So this would be a parasagittal section through your knee joint, and well, it says sagittal here, but because it's not right in the middle, I call it a parasagittal section. And in this cartoon, we're going to focus on the posterior and anterior cruciate ligaments. So remember, ligaments take bone to bone. Ligaments in the synovial joint, they're made of dense, regular connective tissue. They're there to, the ligaments are there to stabilize the joint. But specifically, these cruciate ligaments protect the alignment of the femoral and tibial condyles. And they limit the movement of the femur both anteriorly or forward and posteriorly backwards. That then prevents hyperextension of the knee joint. So posterior and anterior cruciate ligaments, when they're intact, prevent hyperextension. But in general, the major role of ligaments is to direct movement and restrict undesirable movement. So the ligaments are there to help keep the joint in place, and then the articular surface of the joint, it plays a minimal role in joint stability, but it does play a minor role in joint stability. Okay, in this cartoon, I've got the lateral and, well, they're both, this shows the lateral meniscus, and then if you could look on the other side of this cartoon, you'd see the medial meniscus. So menisci are just pads of fibrocartilage between articulating surfaces. Usually divide the cavity into two spaces, like the temporal mandibular joint and the knee joint have menisci. There's also, within the joint, you have these things called bursae or a bursa. And there's, in this cartoon, you can see there's a deep infrapatellar bursa. So here's the patella, here's the bone, here's the, and so infra means below, so here's the infrapatellar bursae, and it's just a sac filled with synovial fluid, and it keeps structures from rubbing against each other. For example, here's a patellar ligament, here's the tibia, and you have the bursa in between the two to prevent rubbing. There's also, for cushioning of the joints, there's these fat pads. So fat is usually orange or yellow in a anatomy and physiology cartoon. And then I've got down here the patella is embedded in the quadriceps femoris tendon. So here's the quadriceps femoris, here's the tendon, and then it runs over the top of the patella. So it's in the patella is embedded in that tendon. This is more about the menisci. So this is a superior view of the tibia. So this bone, here's the bone part, this is the tibia. Here's the lateral meniscus, and here's the medial meniscus. And these menisci are made of fibrocartilage. They act as shock absorbers. They prevent the femur from going from side to side. So these, you can see the way they're like these cups. They prevent the femur from rocking on top of the tibia. This is a cartoon of the elbow joint. So here's the humerus, here's the radius and the ulna. And for this, I want you to take a look at how this annular ligament, so annual means comes around annually, so they call this annular. It goes around the head of the radius, or the annular, in other words, the annular ligament surrounds the head of the radius. Okay, now we're going to look at the structural synovial joints, the subtypes. So in the first one, we have a subtype of the synovial joint is a plane joint, and shows the an example is an intercarpal joint, and you've got a flat surface, and there's no axis, so there's no axial movement, so they call it non-axial movements because there's no axis between the bones for them to rotate around. If it's a non-axial joint, that means that there's no flexion or extension, abduction, adduction, or rotation. So the next type of joint is a hinge joint. This is a uniaxial joint, so it has uniaxial movement. So you can see here's the lateral, here's the axis. They don't really, this is an imaginary axis through the bone, but it does permit movement around that axis, but only one type of movement. So it's uniaxial. So it's uniaxial movement. Example is the elbow joint. And I have a better cartoon of this, so that it's a hinge joint at the elbow joint. So here's the humerus, here's the trochlea. This is the convex surface of the trochlea of the humerus, fits into the concave surface of the trochlear notch of the ulna. It's a hinge joint, so it's a subtype of real joint. This is the TMJ is a modified hinge joint, and you can see here's a normal mandible as forming a hinge joint with the temporal bone. So specifically the condylar process of the mandible right here fits into this thing called the mandibular fossa of the temporal bone. And when you get a dislocation, what happens is you can get a dislocation anteriorly, so the mandible goes forward with the mandibular condyle, or the condylar process of the mandible that used to be in the mandibular fossa here, is now in the infratemporal fossa of the temporal bone. The next type of category of synovial joints is a pivot joint, and again it has one axis, so it's got uniaxial movement. And the examples are the proximal radio-ulnar joint, so that's this cartoon here. It permits rotation, but just around one axis. The next type of joint is a condylar joint. It has biaxial movement, so here's one axis that you can rotate around, flex and extend around, and then here's another axis that allows that joint to do both adduction and abduction, so it's biaxial movement. The next type of joint is a saddle joint, and this looks kind of cool because this looks like a saddle, and then here's the legs of the rider. It's a biaxial joint, so you have two axes, so here's one axis and here's another axis that permit an abduction, flexion, and extension. The next type of joint, a synovial subcategory of a synovial joint, is a ball and socket joint, and it has multi-axial movement. So look, it's got 1, 2, 3 axes that you can move around that joint. Ball and socket has the greatest amount of movement of all the joints. It can flex, extend, abduct, adduct, rotate, and it can circumduct. And examples are the hip and the shoulder joints. So this you can walk through all these movements on your own, but the idea is the shoulder has to sacrifice some strength and stability of that joint to gain maximum flexibility of the joint. So angular movements then at synovial joints can decrease the angle between the bones in a joint, or you can increase the angle between bones in a joint. And this just shows all the different types of angular motion, or aka angular movement. Rotation at a joint doesn't change the angle between bones, so you can just, in anatomical position, rotate your arm and you're not changing any angle. But if you take your arm and you circumduct it, so you move from the shoulder, you move in a circular path, you are changing the angle between bones. So rotation, in other words, doesn't increase or decrease the angle between bones, but circumduction and all the movements within circumduction, which are adduction, abduction, flexion, and extension, those are all movements within circumduction. All of these motions can increase or decrease the angle between bones. And I think we had this in our very first lecture, but it's types of movement at synovial joints. So you should know all these different types of movement at synovial joints. But know that the terms inversion and eversion pertain only to the feet.